And we are now joined by Coleen Boyle with the CDC. Coleen, good morning.
Good morning.
Well, welcome to AMCHP TV. We've been asking everybody what their favorite part of coming to the conference is. Tell me about yours.
Well, first of all, AMCHP is one of my favorite conferences. I said that yesterday when I gave my opening remarks. It has energy, has excitement, and the part I like the best is really networking with people. So this morning at the poster session, being able to talk to the state people who are running the early hearing detection intervention program, the people who actually are working on the Learn the Signs Act Early program, which is helping families and healthcare providers and doctors identify children with developmental and other concerns early. So it's just great. It's great to be able to hear what's happening out in the field, out in the community, and that's my favorite part.
Well, tell me what's going on inside your world. What are the biggest concerns right now in your department?
So we're all about trying to make health better for children, babies, young children, and then people who are living with complex, whether it's an adult or a child, living with a complex medical condition. So here at this conference, we call them children with special health care needs. And we're trying to make sure that our data actually get into action. So I'll give you a really good example. One issue that we're working on is trying to make sure that medications that are used in pregnancy are safer. And that doctors and women are more knowledgeable about the risks and benefits around medication use. So 9 out of every 10 women in pregnancy actually use a prescription medication. That means there's a lot of pregnancies being exposed to potentially harmful chemicals, and we want to be able to minimize that, and not to tell women not to use medications, but to talk to their healthcare provider to get the best information. And our initiative, which is called Treating for Two, is really trying to bring better data and better information, better guidance to healthcare providers, doctors, dentists, whoever it may be. So I know you as a woman, yes, when you go in and you get an x-ray, they'll always ask you about your pregnancy,
yes, they
right?
will. Every time.
Well, we want the same thing to happen when prescribing medications. And that every healthcare provider, every doctor, every dentist, if you have oral surgery, a tooth extracted, that they ask you whether you could possibly be pregnant.
They don't do that
No,
already.
they don't. I know. Isn't that amazing?
It does surprise me.
We want to change how practice happens. So we want to make sure that those medications, simple things like that, making it safer in pregnancy.
How do you make those changes, though? Is it just all coming to conferences like this and talking to people, or
it's part of that, but it's really building a coalition. So we're working at the federal level with the Food and Drug Administration, who controls access to drugs. We're working with healthcare provider organizations like the American Academy of Pediatrics, the American College of Obstetricians and Gynecologists, and primary care. So we don't just want to focus on those individuals that do women's health, but if you're going to go to your dentist, we want to make sure that your dentist is aware of these kinds of things. So it's really trying to build this umbrella and really get this message out and just change how it works.
Well, it's very interesting because just by saying this, and every woman who's watching this at the conference may now go home and ask the right questions.
Yeah, so we know it works, in a certain sector of medical care and procedures, so we want to make sure it works in others.
All right, so how do we take this home to your particular department, the things you talk about at AMCHP, and make them a reality?
Well, AMCHP is great because it allows me to better understand, and again, the Treating for Two is just one particular area, but it allows me to better understand how our programs are working on the ground and how we can connect programs, which is really important. So, if we're talking about screening children for hearing loss and the ability to be able to make sure that those children who are identified with a potential hearing loss actually get diagnosed, and then also connected with services, because it's one thing just to identify the child, but it's a whole other thing to make sure all those pieces fall in place and those kids are benefiting from early services. So for me, it's understanding the struggles of programs on the ground to make that happen. So that's what AMCHP does for me.
Well, Coleen, thank you so much for joining us. Very interesting.
Well, thank you. Yeah, it's great. It's great work. It's great work that what AMCHP does, and it's just a really pleasure to be here.
Fabulous.
Yes.